Okay, I think we will go ahead and get started with our presentation today. Um, Today is all about the dangers of prescription drug use. And my name is Kathy Schwartzhoff. I'm one of 3 mentoring coordinators at Helping Services, and I'm also a certified prevention specialist. It's very exciting that we have so many people online right now. There's 33 people that are here. So that is just really, really amazing. So thank you everyone for being here. And we've got a lot of really great information that'll take us all of the hour to get that done. And before we do much more, we're going to have a little discussion about, some of you may be wondering, why is Helping Services and particularly youth mentoring involved in this presentation? I would like to welcome Meg Gellner. She is the mentoring coordinator in Delaware County. And Meg is going to visit with us a little bit about what mentoring is at Helping Services. So Meg, go ahead.
Thanks, Kathy. Can you guys all hear me okay? Okay. Well, first of all, I'm really glad to be on with you guys tonight. And I'm really excited to see so many people are online right now learning about this. So welcome. So I'm going to tell you a little bit about what youth mentoring is. Right now, we are funded by a grant from the Iowa Department of Public Health, and the grant is called Improving Tomorrow Prevention-Focused Mentoring. So you can see right there in the title, a big part of it is about prevention. And so that is why we're so involved with prevention. So just a little bit about youth mentoring. Youth mentoring pairs a local youth with a caring, dependable adult that wants to engage that youth in a mentoring friendship. Our mentors meet with their youth a minimum of 4 hours a month, and there are 2 different types of matches. You can be matched up in a community-based match or a school-based match. Now, community-based matches are, it kind of tells you in the title there, you can go pick up your mentee, go out into the community and do fun things together. And in a school-based match, just as it says in the title, you go to your mentee's school during a time of the day when they have some free time, and you meet with them in the school, and we provide activities. There's board games, and you can help with homework or anything else that you'd like to do in the school setting. To be a mentor, you need to complete an application process. During this application process, you will answer questions about your history, your interests. This way, we can try to match you with a mentee that has the same kind of interests, and you guys will have some common ground. And you will also be screened. We screen our mentors very carefully as they come into our program. The youth in our program safety are our #1 concern. So when we screen a mentor, we screen their criminal history, child abuse history, the sex offender registry, and also your driving record. So you're really kind of put through the ringer before we bring you into our program. And then once your background checks have been completed and your application is complete, we also call references. And once that's done, you are then interviewed and you're trained. And then we will match you with a local youth that we think would be a good match for you. We have a lot of youth on our waiting lists right now, and so we need mentors. If you know someone who would be a great mentor, or you're not a mentor right now and you're on this call and you're like, hey, I want to be a mentor, you can talk with any of us and we'll get you started. So that's a little bit about youth mentoring, and take it away, Kathy. Thank you.
Yes, thanks, Meg. And the youth in our program are between the ages of 5 and 16. And I'm sorry, 6 and 16. We changed that a few years ago. And so for a long time, I've been saying 5 to 16. So sometimes I have to just remind myself to make sure I get that right. And youth can come from the counties of Alameda, Howard, Winneshiek, and Delaware counties. They have to want to mentor, and the parent has to want to mentor. And that's really about only the criteria that we have, that they live in or go to a school in those counties that we serve, and the desire to have a mentor is really, really important. And the kids and the adults find this to be a very fulfilling type of thing. One of the things that you'll see, like in this picture, we've had to make some accommodations related to people being safe. So there are choices for people to meet in person wearing their masks and keeping social distancing. But also there are folks who are getting together with their mentee and writing letters to each other, being a pen pal, or doing something online. I just heard from a mentor today who's doing a lot of craft activities, and her kid is just eating it up, loving it a lot. And so when we had a mentor play Yahtzee with her mentee the other day too. So lots of really fun and exciting things happen in mentoring. We're always looking for more mentors. We like to have kids too that are from different areas in the counties that we serve as well. So we've got a lot of really great things going on. And as Meg said too, the particular grant that she and I are funded under requires us to do presentations on substance abuse prevention. And as she said, we want to keep kids safe, and we want to help you all to make good decisions and help support those friends and loved ones that you have as well. So before we get into much more, we are going to do a little bit of housekeeping. Want to remind you that today is being recorded, and that is for the purposes so that you can watch it again, or that you can send it to other people that you would like to send it to. So we'll be recording today. And also we want you to mute when you're not speaking. And we really appreciate those folks who have done that, because that's been a big help. And also use the chat box throughout the time. There are going to be particular times where I'm going to ask you to put things in the chat. And I understand that if I can see the chat, there's a big box in the middle of things that blocks your being able to view things. So Meg, if you could keep an eye on that chat box, and if questions come up, could you kind of share what you see? That would be a big help to me.
You bet I will.
Okay. And then too, following the presentation, it may take us till next Monday or so, Monday or Tuesday, I will get you the presentation, the actual slides that you're seeing today, and the recording if I have your email. And if I don't have that, you are welcome to put it in the chat. If you're not comfortable doing that or would rather send me an email, my email is on this slide, and it will be in different parts of the presentation as well. So, and the other thing too, it is very important for recording purposes that we know who is attending. So as we said earlier, if you can share your role in the community in the chat, that would be most helpful. You also might want to look to see if you can rename your first name in the lower left-hand corner of your video window. If you've already given me your community information in the chat, don't worry so much about doing that. But it's just really important that we know that you are here today. So it's great to have so many people here. So what are we going to be talking about today? We want to kind of get in a picture of who's here today. We also want to look at a definition and have an understanding of what prescription drug abuse is. We're going to look at local statistics and information, what drugs are being used, the symptoms of abuse, and ways to reach out, whether that be you individually to another person or working with a group of people doing some things in the community to kind of help out. And then that, of course, wouldn't be complete without some local resources. So the first thing we want to do is to kind of get to know who is all here today. And we are going to, oops, that's not where I wanted to go, folks. We are going to try to do a poll. I'm having a lot of fun doing this, trying to figure out how to do this. Here we go. The first poll is about the county that you live in. And can you see there's a question there that we want you to sign or to indicate what county you live in? So go ahead and just click on the one that fits you. That's great. Some people are voting. That's super. Now there's a good group of people here from different communities. Wonderful. It looks like about half of the people have voted. We'll wait just a few more minutes. Okay, and then I'm going to just share the results of that first one. It looks like we've got about 19% of people who are here from Allamakee. We've got 5% from Buchanan, 10% from Clayton. Whoa, Wenatchee County, look at you guys, 57% and 10% of others. That makes me curious of who we missed. So I'm going to relaunch this poll because it looks like some of you may have gone down to the next one, but that's okay because we're going to start over with this one. We want to get a picture of who you are as far as your role in the community. So go ahead and just do number 2 at this point and share about if you're a parent, a mentor, an educator, an EMT, paramedic, first responder, college student, grandparent, business person, or other. And you should be able to do more than one. And even though you've put some of this information in the chat, it's kind of interesting to see it all collected. One thing I will tell you is I don't see who says what. All I can see is numbers, and you'll see that too when we share it, that you'll only see the numbers. And welcome to the people who joined us. We're taking a quick poll to kind of see what role you play in the community. And if you can take the poll right now, about half of the folks have indicated their information, and we'll wait for you to get that. Hopefully you can see that on your screen. So here's what those results are. I'll scroll down here just a second. And it looks like we have 18% are parents and guardians. We have the same number of mentors. Woo-hoo. And look at that, educators as well, the same percentage, and the EMTs are the same percentage. What is the likelihood of that? And those college students are rocking out the house with 47%, and grandparents at 6%. So wonderful. Okay, we're gonna relaunch. This will be our last poll that we'll take. And this one is kind of gaining some insight into why you're interested in this topic. Do you want to just get some new information? Would you like to share it with friends and family that you're concerned about? Is this something that you want to do in the future? help you with some things that you may not know about right now. Wow, you guys are getting fast at doing these. That's great. And this one, we've got about 70% of people want to gain new information. 5% are looking to help a friend or a relative. 30%, do you like that terminology I used about being an education geek? There you are. And 55% want to gain this information for the future, for their mentee, patients, or friends. And thank you for you folks that have a sense of humor, that you like to hang out with us. So that's great. Thanks, everybody, for participating in that. That just kind of gives us a sense of who's here today. So, and also it kind of helps you too to know that there's other people from your county, there's other people that have the same role that you have in the community, and helps us feel like we're in this together. So what we're going to be doing next is looking at, I'm going to introduce you to 3 different individuals who I'll say their names, and then also describe a situation that they have encountered. And I'm going to ask you, and we're going to use the chat to do this. So Meg, I'll need you to be looking at what you see here. We want you to vote who you think of these 3 people is actually abusing prescription medications. So this is Terrence. And Terrence has been prescribed opioids for a back injury. He regularly takes more than the prescribed amount for pain. And wait till you hear all 3 of them. This is Kim. Kim had a shoulder injury about 2 years ago and was prescribed OxyContin. His friend just hurt his shoulder, and Kim gives him some pills to get him through the night. And this is Sarah. And Sarah decides to kick back on Friday night. She pops some of her Zoloft that she takes for depression, drinks a glass of wine before going out drinking with the girls. So in the chat, if you would be so kind to write down or click in there, or you could unmute if you would like to, because sometimes people are having trouble with getting into the chat. If you just want to shout out who you think, the name or names of people that you believe are abusing prescription medications.
We've got a lot of all 3, Kathy. Folks are saying all.
Is amazing, because that is the correct answer. That's really good. So we want to share according to the National Institute of Drug Abuse, the actual definition for prescription drug abuse has all of those components. That someone is taking a medication in a manner or dose other than prescribed, taking someone else's medication, even if it's for a very legitimate cause such as pain, or taking medication to get high or feel good. So that's the exact definition related to that. I'm going to ask you a question, and again, you can put this in the chat or give a shout out, whatever you're comfortable with. What do you notice about these 3 people?
It says they're regular people, they're all different ages, they all look quote unquote normal, age, race, they're not downtrodden, they seem normal, like everyday people.
Exactly. And that's one of the things that I really wanted to point out is so many times we have this picture of what someone looks like that's struggling, and we may not be able to see their true struggle. And they can be very good at hiding their addiction or their abuse. And I'm really glad you saw the different ages, the ethnicity, that they don't look like they're kind of in trouble, if you will.
Karen made comment that there is not an actual stereotype for abusers of prescription drugs. That's a great comment.
Yes, that is a great comment. Thank you. So thinking about the topic today, you may have asked yourself, how prevalent is this here? And to begin, we're going to look at information from the Iowa Youth Survey. And the Iowa Youth Survey is a collaborative effort by the Iowa Department of Public Health, the Iowa Department of Education, the Office of Drug Control Policy, the Iowa Department of Human Services, and the Division of Criminal and Juvenile Justice Planning in the Department of Human Rights. I did not know that previous to this. I thought it was just one entity that put it all together. So it's really helpful to know that the Iowa Youth Survey is taken by students in 6th, 8th, and 11th grades in their school, and the school decides if they're going to administer it to the youth. And then the information, it's kind of like a census from the idea that information's collected and then can be shared to folks. And you can look at county data, you can look at statewide data, you can look at the school district data and some other avenues related to geographic areas. With the school districts, you have to ask permission to get that from the school superintendent. And they don't always give permission to everyone because they want to make sure that the data is used correctly. So in this first chart, and hold on just a second because I'm going to admit somebody into the training. In this first chart, it was from 2016, and the youth were asked in the past 30 days, have you used prescription medications on any days during those past 30 days in a way that they were not prescribed? And as you can see from this chart, it's lumped together by the different grades, by 6th graders, 8th graders, 11th graders, and then all grades. And one thing too, I'll also point out is looking at that purple column is a really good sort of criteria to look at because it's the average throughout the whole state. So if something is higher than the average, like the 6th graders in Winnebago County, it's a concern. But another good example is those 8th graders in and in Howard counties aren't a real huge problem. And so it's just a good idea to kind of look at this information. And I am getting some feedback. If someone would, maybe someone that just joined, if you can try to mute your line, that would be great. And that would help us with some background information that we're hearing. So some information that was shared by the CDC was about 12th graders, that after alcohol, marijuana, and tobacco, prescription drugs are the most commonly used drug by 12th graders. And then this next chart, again, was from the Iowa Youth Survey, but was 2 years later. And the question that was previously that we looked at wasn't asked in 2018. The question was changed to ask in the past 30 days, have you used illicit opioids and prescription opioids? And then this chart is set up a little differently. It looks at the counties gathered all together. The other thing I do want to point out is on the other chart that we looked at, it only went up to 4%. This chart goes, I'm sorry, it went up to 8%. This one goes up to 4%. So actually, use went down, and there's some reasons for that that we're going to learn about later on. You can also see here too that there are areas that it's a lot of a concern, specifically when we look at Winnebago County and those 11th graders and Howard County, the 11th graders. Those were bigger pockets of youth using. And then two, the Monitoring the Future survey is done not on the same years always as the Iowa Youth Survey, and 3.9 of high school seniors misused the drug Adderall in the past year. The information from 2 years before that, in 2017, it was 6% of seniors misused Adderall. So let's meet Mike, and we're going to see if this works. And let me know if you can see that.
Mike is a thoughtful.
Oh, thanks.
We're gonna
A great baker.
It wasn't too hard.
And he was. Mike is a thoughtful neighbor.
Oh, thanks.
A great baker.
It wasn't too hard.
And he was voted silliest dad ever by his 2 girls.
It's my favorite title.
What Mike's not good at doing? Getting help for his drug addiction.
I don't know where to turn.
Mike, Your Life Iowa is always here for you.
I don't want to live like this.
We know you don't. We can help. See the person, not the addiction.
Okay, so I guess a question to kind of think about is, in those first part of that, seeing Mike out on the lawn and seeing him at the birthday party, would you have figured out that he was having a problem? And just kind of give that some thought, kind of related to how we looked at the people in the beginning. And I love the message of this, of see the person, not the addiction.
Well, Kathy, we could not see the video. We could hear it, but we could not see it.
You could not see it. Okay, that's helpful to know now. So, well, Mike looked real vibrant, I'll tell you that. So, all right. So, and two, he had a very downtrodden look on his face when he said, I don't know where to turn. So, all right, so that's good to know. So, kind of continuing in that, but local kind of where things are at, use is really across all the ages. And misuse is the highest among young people between the ages of 18 and 25. And they are more likely to report use of other drugs as well. And multiple studies have shown that there's an association between prescription drug misuse and higher rates of cigarette smoking, heavy episodic drinking, use of marijuana, cocaine, and other illicit drugs. And I want to tell you a little bit about a survey that was done very recently by Helping Services. There were 480 people ages 18 and older from Allamakee, Clayton, Fayette, Howard, and Winneshiek counties. And this question was asked of them: how much do you think you risk harming yourself if you use a prescription medication that is not prescribed for you? And 78% of the respondents felt you could moderately or greatly harm yourself. And that just kind of gives us an idea of very, very local data of adults realizing that there is harm in this one instance of asking about prescription medication. It would have been interesting to hear kind of more of some of the other things, but the survey involved a lot of questions. So that was information that was great to hear about. And we've been talking a lot about the user themselves. There's also obviously a component here of providers who write the prescription and the pharmacists who dispense or give out the prescription. And in 2018, 49.3 prescriptions were written for every 100 persons, and the national rate is 51.4. So kind of interesting to see that we're right up there with that number. And thinking a little bit about older people, 80% or more than 80% actually of older adults ages 57 to 85 use at least one prescription medication on a daily basis. And more than 50% are taking more than 5 medications on a daily basis. And this can lead to unintentional use of those medications, or they being used in a manner that they weren't prescribed. And also intentional misuse as well. And misuse is certainly more dangerous for older people because they have a higher rate of multiple chronic illnesses. Their drug metabolism changes as they age, and the potential for drug interactions can certainly be a part of that. And I know too from personal experience that older people sometimes aren't as good as when they were younger at remembering all of the pieces to taking their medication properly. And then on a more somber note, talking a little bit about opioid deaths. On this chart, we want to look at the dark blue line that's at the top. And you kind of wanted to start where it starts at 2001, where it's very low. And this chart only goes up to 2018. But I do want to point out that in 2017, there were 104 deaths. And it went down to 64 in 2018. And the other thing I really want to point out is the peak seems to be 2012 and kind of stays real close to that in 2013. And that is significant from what we're going to talk about later about some things that have happened nationwide to help with prevention. So we kind of jumped ahead with maybe talking about some of the drugs that are commonly used. And the most commonly misused prescription drugs include opioid pain medication, sedatives, and stimulants. And we're going to start by talking a little bit about opioids. And I will say that in this, I've just listed a few examples of the different kinds of medicine. It's not an all-inclusive list, but I tried to find ones that most people have heard about so you can kind of associate with that. So opioids have been given for centuries to help people with pain relief, and really acute pain was where things started. And then in the 1990s, there was a shift to prescribing them for ongoing or chronic pain. And studies really haven't shown that that is the best way to go. There's certainly a danger in misuse here and overdose related to opioids. And the other thing that is kind of interesting too, when you see this R, that means that it's actually the brand name for that particular drug. Another kind that we want to talk about is stimulants, and those are help increase alertness, attention, and energy. And they were originally used to help treat asthma, other respiratory problems, obesity, and neurological disorders. But now they're more more prescribed for ADHD, narcolepsy, and occasionally treatment-resistant depression. And then CNS, which stands for Central Nervous System depressants, are a category that includes tranquilizers, sedatives, and hypnotics. And they're meant as this shows you to calm, to slow things down, slow down brain activity, are commonly prescribed to treat anxiety and sleep disorders. So we have a quick video, and I hope you can see this. So we'll see if it works out. And please let me know right away if you can't see it, and I'll try doing it a different way. And there's no sound right away.
The smell of someone's breath or clothes, bloodshot eyes, slurred words. The symptoms of alcohol or marijuana use are obvious and familiar. But what does it look like when someone is under the influence of an abused prescription drug? The symptoms of prescription drug abuse tend to be more subtle and difficult to identify. The symptoms also vary based on the prescription drug being abused. Some symptoms are visible when a person is under the influence of an abused prescription drug. For example, abusers of all prescription drugs may demonstrate excessive mood swings or hostility. Among people abusing opioid painkillers and depressants, the most common visible symptoms are confusion, drowsiness, poor coordination or clumsiness, and poor judgment. In contrast, the most common visible symptoms of stimulant abuse are agitation, irritability, and appearing to be high, unusually energetic, or revved up. Other symptoms appear as a pattern of behavior over time. You may notice increased secrecy or anger when being questioned about activities or whereabouts, apathy, loss of interest in favorite activities, or a lack of energy, change in appearance, including poor hygiene, drastic changes in eating or sleeping habits, and dramatic changes in school performance, including skipping school. What is more, there may be clues in the home that someone you know is abusing prescription drugs. These clues include cash and other valuables missing from your home, prescription drug bottles without labels or labeled with another person's name, loose pills in a pocket, purse, or bag, and missing pills from a family member's prescription, or having to refill a prescription earlier than expected. Because prescription drugs affect the brain and body, overdoses of these drugs can cause changes in heart rate, breathing, and even death. If a person is unresponsive, call 911 immediately and share your concerns about prescription drug abuse with medical professionals.
So the video did a great job, I think, of telling us not only these are listing some of the physical things that happen to your body, but the video also said things to look for that you notice in the person and their behaviors and acting differently. So really, I really like that video because it gave some great information. This is the slide that shares the information that's going to kind of help us with some of those statistics. These are recent things that are somewhat recent things that have happened that have affected the their milestones related to prevention efforts. And something that's called PDMPs, or prescription drug monitoring programs, started way back in 1918. But in 1989, they went to an electronic version. And in 2003, they are a process to track the prescribing and the dispensing of medications. So in 2003, the results of the Harold Rogers Prescription Drug Monitoring Grant was provided federal funding for states to implement and enhance their PDMPs. So that was a big thing to start in 2003 and took some states quite a long time to perfect their process, but it was a very important piece of some of the prevention that was happening. And in 2015, the federal government launched an initiative directed towards reducing opioid misuse and overdose, and by promoting more cautious and responsible prescribing of opioid medications. And then in 2016, the CDC, the Centers for Disease Control and Prevention, which we hear a lot about these days when we're talking about COVID, they published their guidelines for prescribing opioids for chronic pain. And this established clinical standards for balancing the benefits and the risks of chronic opioid treatment. And then in 2017, President Trump established the President's Commission on Combating Drug Addiction and the Opioid Crisis. And he set out the commission set out several priorities to work on. Some of those were looking at the bureaucracy that was happening related to it was getting in the way of helping with the crisis. So they looked at how that could be lessened. They also looked at working with states and the private sector to enhance awareness and prevention of use. They also looked at some of those PDMPs to make sure that the monitoring systems were in place. They had efforts related to educating medical professionals to reduce inappropriate prescribing, to strengthen law enforcement, prevention, treatment, research and development, and to expand access to overdose reversing products such as Narcan, and then also looking at how drugs are getting into our country related to our borders. And so that began in 2017, and it's actually pretty remarkable, all of the things. There was a study that I looked at that was 1 year later, and there has been a lot done. And that also gives you some insight into how all of these efforts have lessened that death rate that we've talked about earlier and influenced some of the choices that people are making. And that's kind of the big picture. So next we're going to look at what can we do? What can little old me do? And first thing is to just only use your medication as directed by your health professional. Don't share them with other people. Don't pair your alcohol and other drugs with medication. And then keep your medications safe. And this seems so simplistic, but it is so important. You can purchase a little lockbox like the picture here and keep everything in a safe place so that other people can't go through it when they're at your home. Just a very simplistic thing to do. And one more thing that's really important, it gets its own slide, is to properly dispose of your medications. And this past Saturday was the National Drug Enforcement Administration's Take Back Day. And it wasn't as well participated as it has been in the past. You can probably guess with COVID that it wasn't, that was the reason that people wanted to keep contact down and stuff. But one thing that is really awesome is in our area, there are permanent sites, places that you can drop off at any time your medications at their site. And this is just a few examples of ones that are in Howard County, in Winneshiek, Alameda County, Fayette, and Delaware. And I know too, there's some of you who are from Clayton. I'm sure that there are some there. And I'd love to know what those are. If you could email me those, because we are going to be sending out this PowerPoint, and we can certainly add more permanent sites to it so that people do know what's in their area. So I'd appreciate that if you'd share even more. So a very, very important thing too is to talk about what you've learned or what you've observed, and wanted to just kind of share some possible conversation starters to have with someone. And it could be as simple as, oh, I heard on the news, last week that Purdue Pharma, who makes OxyContin, is in legal trouble for people getting hooked on their drugs. What do you think about that? Another possibility, I was on this webinar about prescription drug abuse. Kind of scary how people get addicted. And another thing that just kind of shares a little bit about, these two are more about noticing the behaviors. Hey, Terrence, I notice when refilling your meds that you're taking too many. I'm worried about you. Hey, buddy, you've not been yourself lately. You're missing meetings at work and so confused most of the time. It's not like you. What's going on? And one thing to think about too is maybe not everybody's ready to start talking that you're talking to. Maybe they're not ready yet to talk to you. Don't take that personally. Don't get upset. Just kind of know that you can come back and check in with them at another time. And they could be just like Mike, where they don't know where to turn and they need somebody else to talk to. Okay, I'm going to X out of that and we're just going to skip the video. It was about an Iowa State patrolman. His name's Mike Haugen, and he became addicted to opioids after having a chronic gastrointestinal issue. And it shares about how his wife had the impression that all users were lowlifes and people who would never accomplish anything. And he really shares that if it can happen to me, it can happen to you. And wants people to be aware of that. It doesn't matter what your walk of life is, and it doesn't matter if you're a good, upstanding person, it can happen to you too. So that's the main message. And the video link is also here. So when you get the presentation, you can look at that as well. So some things to keep in mind is be mindful about what you've learned today. Share your concerns when you have them with someone. Check in and listen, as I said earlier, and then to suggest available resources. And some of the resources I put together, I know this is not an all-inclusive list, but at least it gives us an idea of some of the local resources. Northeast Iowa Behavioral Health is in many of our counties. And again, you're going to get this when you get the PowerPoint, so you'll be able to click on them. This is an example. Lighthouse Professional Counseling is an example of a local provider that you could possibly see. Luther College has counseling services that are free. And Gunderson and Palmer Lutheran have many wonderful resources as well. And then the video that you unfortunately didn't get to see was brought to you by or created from Your Life Iowa. And I am going to talk about that a little bit more later, but it is an actual website that you all can go to. Anybody can go to and get lots of wonderful information. And then a resource that's great is your county substance abuse prevention coalition. They are folks who work on if it's binge drinking or if it's tobacco-free trails and parks. The group decides what they want to talk about, and it's a wonderful group to kind of get involved with and do some prevention with other people and to kind of keep tabs on what's going on. They always share great information. And we can get you their contact information as well. So one thing I will share too, because we're getting close to our time, please don't log off until you write down that evaluation that's on the bottom. We want to be sure that you get that done. And Meg and I are going to be doing a training like this on problem gambling in November. It's the same information on 2 different dates, the same time frame, and it will be on Zoom. And again, we'd love it if you pre-register. We will be sending you the information so that you get that. And would love to have you because we're going to have so many good things. And the other thing that we want to share about is we want to tell folks more about Your Life Iowa. And we can do presentations any place, in your workplace, your civic group, your book club, whatever group that you want to direct us to. And you can email us at mentoring@helping-services or email me and I'll get information to Meg if it's in her area. So Again, we'd like you to fill out the evaluation. Just jot down that link there, www.bit.ly/RX evaluation, and fill that out today. And we just have a few minutes for folks to ask questions. And then EMT folks and folks who are in that field, if you want continuing education hours, please send me an email. Many of you have done this before, and I've got yours, but if you're someone new, please be sure you send me an email, and so that we have a record of that you're here so that you can get your continuing education hours. So, all right, I will leave this screen up for a bit. So if you didn't get that chat, or I'm sorry, if you didn't get that evaluation link, you can get that. And thank you all for coming. I'm sorry we didn't have enough time for questions, but you certainly also can email me those as well, and we'll see what we can get, how we can get you great information. So thank you everybody for coming.